ask a couple polling questions of the audience here, and this is the first time we're playing around with this poll feature, so bear with us a little bit. But Emily, can you pull up our first polling question? And I ask everyone who's on the webinar with us to go ahead and participate in this poll. So the first question is, what are you most concerned about as your business continues to be open or as you prepare to reopen? Please check your top 3 areas of concern. I'll give everyone a couple minutes there to look through those options and make your choices. And Emily, as it looks like responses are slowing down on that, why don't you go ahead and share the results? Okay. So it looks like the top concern is being held liable if an employee or customer contracts COVID-19. That's at 55%, followed by consumer demand. Will there be enough? And then a couple other high ones are having the appropriate HR policies and procedures in place, as well as being able to purchase enough PPE supplies for employees and customers. Okay, great. Thank you for participating in that poll. We've got one more question for you. Emily, can you pull up the second question? Which of the following precautions have you or will you plan on implementing? For this one, please check all that apply. And we'll give you a minute or so there to look through all those and make your selections. Emily, as things start to slow down in responses, go ahead and share the results of that one. Okay, highest percentage, 91%, cleaning and disinfecting surfaces and items more frequently, 88% providing hand sanitizer to employees and customers, and then the third largest one, requiring employees to wear face masks, and then the next one after that, oops, I missed one here. Limiting the number of customers in your business at a time and rearranging layout to ensure 6-foot separation. And each of these got some responses here. So everyone doing them to varying degrees. So great. Thank you for participating in those polling questions. We wanted to use that as an opportunity to kind of just get some quick data back that'll frame the conversation of this webinar, as well as hopefully you learn from others just to see, you know, where the data fell there. So thank you for participating in that. Okay, now for the panelists. I'm really excited. We've got a great panel for you here today that kind of represents a cross section, not just of industry in terms of businesses, but also in terms of openings, in terms of businesses that have been open throughout this, as well as those that have just begun, and as well as those who will be planning to open. So we've got with us today Jacqueline Townsend, who's the Human Resources Leader for P&G Oral Care here in Iowa City. We've got Joni Schrupp, who's the owner of Discerning Eye here in downtown Iowa City. Dan Blum, who's the co-owner of 30 Hop Restaurant in Coralville in the Iowa River Landing. Got Sam Jarvis, who's our community health manager with the Johnson County Public Health. and Craig Muirman, who's a partner with Phelan Tucker Law LLP. Thank you to all our panelists for being with us here today. And what I'm going to do, we've got Sam, who needs to leave us at 2:30 here. And so I want to turn things over to him first and have him talk about what guidance Johnson County Public Health has for businesses, especially around ensuring that both customers and employees remain safe during this time as we move into the reopening phase. So I'm going to exit out of my PowerPoint here and turn things over to you, Sam.
Great. Thank you, Kim, and thank you for having us. So in terms of guidance coming out, we know that everyone's been kind of thinking about this for quite a while, and I will state that early on, we had staff here reach out to other businesses preliminarily to see kind of where their thoughts were at. And so we've got some information regarding that, and going forward, we thought what was best, as we saw a lot of guidance documents being produced and sent out and shared, a lot of great information. What we're looking at doing is releasing baseline guidance sometime this week, more than likely Friday, for businesses to be able to review and kind of look at. But going forward, we wanted to continue to take an active role and make it more of a conversation. So that guidance will be released, and we'll be looking at having staff engage with different business partners and community members who have questions about that, and really looking at, I won't say tailoring guidance, but really making sure that we're addressing questions. And I think a good example is, you'll see documents state, perform a deep clean, and how deep, what does deep clean mean, and things like that. And so we really want to just make sure that we're as clear as possible, and want to avoid any frustrations that guidance documents can bring, because we know, in true kind of government fashion, there will be a PDF generated, and it's here, take this, and kind of a good luck, call us if you have any questions. But we want to build it together and keep that conversation open. So that is what our goal being, to produce guidance going forward, and we're pretty excited. So happy to answer or ask any questions that you might have. So.
Great, Sam. Thank you for sharing that. We'll be on the lookout for that guidance on Friday. Now I want to turn things over to Jacqueline here to talk a little bit about what P&G has been doing to continue production and keep employees safe during this time. You've been open throughout this pandemic. So what are some of the things that you are learning, and how have you adapted your operations?
Yeah, so I just wanted to thank you, first of all, for having me, Kim. As you mentioned, we have been open through this entire event. Early on, we were established as an essential business, and so that's really what kept us open. So I'm excited to share the great work that we've been doing throughout. With P&G being a global company, we really started our response for work on COVID-19 back in February. And the word that we keep using as we think about this is unprecedented. And it's amazing that over the past few months that we don't really say that anymore, because it's kind of just our new normal and the way that we're functioning. And so when I think back on that and what we've done in a matter of months, I'm just truly inspired by our employees that have really stepped up and have shown how resilient we are as a community, as well as the great work ethic and passion that we have and we're fortunate to have locally. As I said, we started back in February. We have some pandemic checklists that we have in place as we think about business continuity plans. And what we really established prior to there being community spread is that good hygiene, social distancing, and cleanliness are just paramount to keeping this disease out of your sites and keeping your employees healthy. So we started by just communicating to folks that that's really what you need to do. Here's the appropriate way to wash your hands, going back to that step. And then really starting to talk social distancing before that was a term that we used. I didn't know what social distancing was prior to February. And we started educating folks on what that was, what it meant. It's you don't want to be less than 6 feet for more than 15 minutes, and then encouraging that cleanliness. We also started evaluating travel. So where were people going, and did we have folks that were coming on site? And we implemented a process to screen any visitors that were going to be on site, as well as establishing ways to have our employees communicate with us if they were traveling, or if we had anyone on site. And so we started with just those screening questions of do you have any symptoms? Have you had exposure? And have you been to any of these areas that we were concerned about? And so it was relatively low key in February. And then, mid-March, we had community spread happen. And honestly, I woke up, I think that we got news of that on Saturday, the 14th. And I woke up in the middle of the night and just realized, oh gosh, it's here. And we're really going to have to step up our game if we're going to want to be able to function and keep everyone healthy. And so I made a list of action items and got our crisis management team together Sunday morning on the 15th. And we really started by talking about how we wanted to educate and communicate with our employees. We established daily crisis management team meetings that included both that small kind of elite team that was dealing with specific COVID concerns, and then creating a drumbeat of educating our broader leadership team on a daily basis so they always knew what we were doing. And then we got our entire leadership team together once a week so that they were also informed of what was happening and could share that throughout their teams. Because with us being a manufacturing facility, we operate 24/7. And so to ensure that you're educating and informing all of your employees and that they all know what's happening, that was really important. And so we ensured we were communicating multiple ways, making things as visual as possible. So we took chairs away from the tables. We used to have 4 seats at a table. We now had 2, and then we had some information regarding social distancing at tables so that it was really visible. Hand washing, we posted that directly on our mirrors. We closed off every other sink in our restroom so that folks started to understand that you really do need to stay 6 feet away from each other. So even if you weren't getting all that information, you had multiple ways that you were hearing and seeing things to really make it visible. We got sub-teams together. So we had an office sub-team, cafeteria sub-team, bathroom sub-team, and contact tracing, because if you try to take this all on by yourself, it is just too much. So you have to go figure out what areas really need some additional focus and detail and attention, and go get a small group of people that can evaluate that, make proposals, and then go make that work actionable. Sam mentioned deep cleaning. We started working with ServPro pretty early on to make sure that if the need arose, that they could come in and clean an area quickly for us. And we actually tested them out a few different times and have just kind of been rotating through our areas to make sure that that deep clean is happening. We opened any doors that did not need to be closed to really stop the high touch points so that those areas are nice and clean. We evaluated in our office spaces if we could do remote working, so that we did have enough people on site to respond, but that we weren't so on top of each other that it wasn't an issue. We created some physical barriers as well. So in our operations, if our folks didn't have room to social distance, we created plexiglass separators, or even we did temporarily some shower curtain dividers where we set up a system to make sure that that there was that physical barrier between people if we couldn't have the 6 feet distancing. We also created our contact tracing group. And what we did there was train a group of individuals that could do contact tracing. So understand if a person was presumed to be to have COVID, that we would immediately do a tracing. And with that, that's looking at their contacts in the last 48 hours, who was within that 6 feet within with greater than 15 minutes, as well as what surfaces they touch, so we could immediately clean. And then if we did identify close contacts, communicating with those folks and having them quarantine. We reconfigured all of our meeting rooms. We also moved some meetings. If the space was too small and we needed to have those folks in a room together, we moved it to a space that they could actually conduct that meeting. And then we made cleaning supplies readily accessible so that everyone could clean their own areas before and after using it. We also started making some items. So the beauty care site started making hand sanitizer. So when you couldn't get any hand sanitizer, we were able to make our own. And I know a lot of other businesses locally have done the same thing. Our film that we use to close and seal our packages when you buy a toothbrush also could work as face shields. So we created some face shields using that, and our 3D printers to make handles that we could put on our doors so that you can use your forearm versus using your hand for touching, just to eliminate those touch points. We established a hotline for our employees. So it was specific to COVID. And we checked multiple times a day to have people to understand what their messages were and what they had going on so we could contact them directly. We encouraged anyone that had traveled, has symptoms or potential exposure to stay home, call that hotline, reach out to their medical provider, and then that allowed us to start tracking them to understand what next steps were. And then we really made sure that we had a direct line from an HR standpoint with those individuals. Not only did we want to make sure that our employees were taken care of, we wanted to make sure that we were contributing to the local community as well, that has always been so great at supporting us. So we reached out to the Johnson County Emergency Management Agency. They were doing daily emergency meetings to determine the need locally. And we really wanted to make sure that we had a quick way to get what we had available to the local community, to the agencies that most needed them. And so we found them to be the best organization to do that. So we were able to provide them hand sanitizer, masks, and some cleaning agents. We also supported the United Way and provided just under $40,000 to them for the COVID response to help. And that was back in March as well. And then, so that's all what we did leading up to it when there was a lot of confusion about what was going on. We are lucky enough being a large corporation that we were able to access masks, and that's why we felt if we were going to have masks for our employees, that we should also be ensuring that the local hospitals and agencies that needed them had access to them. So we do have our employees wearing masks. We take everyone's temperature as they come on site. We have screening questions that folks need to answer on a daily basis. And then we are working on getting some employee handouts as well, so that our employees aren't only safe at work, but they're safe at home. And what I would say is, through all of this, the biggest aha that I have had is that we can't keep COVID out of our place of business. None of us can. Whether someone has it or not, that's just not a reality that we're in right now. But what we can do is we can control the actions of those that are at our site and at our locations. And by doing that, we can help slow or stop the transmission that happens on site. And so that really can best be accomplished by cleaning and sanitizing surfaces before and after use, encouraging people to wash their hands, do that and have the hand sanitizer accessible, socially distance, and then wearing your masks. And that's all I had to share, and open for any questions as well.
That was a lot of good stuff. Thank you so much, Jacqueline, for sharing. And I do want to come back to, a couple points you made, particularly around communication. But before I do, I want to just go back to Sam for a quick moment before you have to jump off here, Sam. A common question that we get is, how will these guidelines, whether coming from your department or Iowa Department of Public Health, be enforced? Any quick comments on that before you jump off?
Yeah, absolutely. So I think what you'll see, and you've seen kind of throughout the past couple of weeks, a lot of recommendations. And so enforcement a lot will be on the facility, really how you want to enact those type of recommendations with your employees and the public. And so, obviously we'll always want to encourage everyone to follow those as best as possible, but recognizing that there's not always a one-size-fit-all kind of approach. Depending on the business too, there's also other entities that we regulate on different side, depending on the code, their food establishments or things like that. So we'll probably not see those intermingled a whole lot, but obviously they interplay quite frequently. So.
Great, thank you for answering that real fast. And I know you have to go, so thank you for being with us today. And know that you're super busy. Thank you for all that you're doing to keep our community safe.
Yeah, I appreciate it. And if there are any other questions or any other follow-up, please feel free to reach out to us. We're definitely wanting to be involved as much as possible and take an active role in helping with reopening guidance and just safety in general. So, but
And
thank you
Sam,
for
what's
having
the
us.
best what's the best way for people to reach out to you if they have specific questions or your department?
They can call our direct line, 319-356-6040, or on our site, we also have a contact email as well. We've got staff here monitoring those and kind of filtering through questions and directing them to the either our disease prevention specialists who are doing the investigations and contact tracing for positive individuals where we're either isolating and quarantining people, and then other staff who are in other programmatic areas, you know, like our environmental health specialists and things. So absolutely.
Great, thank you, Sam.
All right, thank you.
All right, I now want to turn things over to Joni here with Discerning Eye Optical. And Joni, I'm wearing glasses from Discerning Eye that I purchased luckily before COVID-19 because they are saving my eyes right now. So thank you for that. But you've been open by appointment only since May 4th. So I was hoping you can kind of talk a little bit about what you're doing to keep your employees and your customers safe and what you've been learning so far since you've been open.
So thanks for having me, Kim. I appreciate that. Yes, so we opened May 4th. Just prior to that, we had launched sort of a virtual styling. We don't actually have online sales at our store. So we had a deal that you can call. We can do like a FaceTime or a Zoom or something that we can figure out some frames and we can send them to you. So we had done that just before we opened. So, and then we had such a list of people who needed eye exams or glasses. They had so many issues. So we thought, okay, we're going to open. So we had done a deep clean of the store, cleaned every frame, which is no small task here. And so then when we opened, we made sure that all of the employees, and again, this is such a contrast to Jacqueline, there's 6 of us. So it's just, you know, it's just everybody is kind of on the, you know, we are the crisis team, the leadership team, I'm everything. So, but so all of our employees wear masks while we're open here. We have masks at the front desk and sanitizer right inside the door for customers, masks that customers can use or take with them either way. And you know, the distancing in retail is a little bit tricky, especially with our industry, because what we're doing is, you know, we have to check fit and so forth. And so we're trying to limit that as much as possible. And you know, trying to keep a distance. We've decided to, well, we're doing everything by appointment. So even the things that people used to run in for just to get their glasses adjusted or, you know, to grab some cleaner or whatever, everything is by appointment. And so that's a learning curve for both us and our customers. But it's working really well. People, you know, they'll stand outside and call us and can I come in, and the door is open. So of course they can, but I mean, it's just, people are just been great. They really have been. I mean, it's just a different way of doing business. And it's just, even since we opened, it seems like there's so many different things that have changed. And so we're just kind of working on that. We, you know, we sanitize every surface after somebody leaves. We sanitize every frame that somebody touches. We have trays that we put the glasses in whenever anybody tries anything on, and then we can sanitize them. We wash them, but we also have some handheld UVC sanitizers, which I think they work. They're supposed to work. The science says they work. So I don't know how you know that they work, but anyway, so we have those too. Makes me feel better. We use those for keyboards and our mouses and all that kind of stuff. So that's been something different. We have another one on order that's a room size one, so that'll be different. So even in the doctor's office, Dr. Wolf has some plastic shields on all of his equipment so that when you get your eyes checked, you know, there's not that contact, because again, that's another close space, close environment. And we are scheduling people like an hour to an hour and a half in between everybody. So that way we can fit in adjustments and people can come and look at glasses in between his appointments. So again, we're trying to limit it to have just 3 people in the store at a time. I don't know, that's, you know, it's a lot. And we have a checklist. I mean, you know, after everybody has an encounter with a customer or patient, you know, wash your hands, wash your hands, wash your hands. And we just continuously clean every surface. You know, the 6-foot thing, again, like I said, it's not that easy for us, but if we only have 3 people in the store, it's okay, it works. I mean, we've got a pretty large space here and we're lucky, you know, we didn't really have to reconfigure anything in our store because our glasses are on the perimeter of the store and it makes it easier just to walk around, you know, without running into anybody else. I don't know. I think, I don't know, I guess if there's questions, I'm happy to answer them. I mean, we've had pretty good compliance with customers wearing masks. We had some people that just don't want to. And, you know, I mean, I guess if I have a mask on, that I'm okay with that. I haven't really gotten to the point where we're, you know, you must wear one. But most people, if you ask them to, they will do it. And so that hasn't really been an issue.
Great, thank you, Joni, for sharing all that and sharing your learnings. As you mentioned, kind of things are changing daily, meetings with staff daily, and it sounds like you're doing a wonderful job. And I like the idea of those checklists. Like, even though, you know, eventually we adapt, it's just so important, those constant reminders. So thank you for sharing all that. I want to turn now over to Dan, who is again with 30 Hop, and you know, as you prepare to have on-site dining again. I see that you're sitting at your booth in 30 Hop there, which is so good to see. And so, you know, as you prepare for reopening, you know, what practices are you looking at putting in place, you know, as a restaurant? And then maybe also tell us a little bit about the Mask of Wellness initiative.
Yeah, absolutely. First of all, we've been open for carry out for the last 7+ weeks now, and it's just been heartwarming with the ways that people find ways to support you and give you messages of encouragement. So it's been great to see that, and it's been a blessing. So we've spent several weeks just trying to figure out how we're going to keep momentum and take care of our staff. So now we're transitioning to figuring out how we're going to take care of our space to make sure that our employees are healthy and the public is healthy as well, and they're confident in joining us here at 30 Hop. There's several things that we're planning on doing. We're such a big space. We're such a big gathering space. So it is a very big change of pace for our business model. So first and foremost, we're waiting until Monday to reopen. Despite being able to open this weekend, we want to be able to give our staff a little bit more confidence to open on a day that might be a little bit slower, kind of gain some momentum, really dial in our practices with everybody that hasn't been able to join us for in-person training, and just make sure that they all know how important that is to us. So we really have to focus on crowd management with the size of space that we have. So we're moving our host stand outside. We're trying to quarterback things before people can enter the restaurant. We're trying to avoid any sort of congregation opportunities by making sure that we meet them before they enter our doors. If we have to push the brakes on anything and ask people to wait in their car or walk the block, those are things that we're going to be prepared to do, and have kind of invested in some technology to better communicate those things. Our doors will be littered with signage to kind of let people know what they can expect from us and let people know what we can expect of them. We've tinkered with our staffing a little bit. We're going to have sanitization captains every shift. They're going to be in charge of making sure all of our high touch point surfaces are attended to every 30 minutes, if not a lot sooner. Just paying attention to the flow of our customers and making sure that we're kind of following their trail and making sure that we're wiping all the surfaces they're leaving behind. So kind of having that dedicated person to making sure we're following our checklist, and also busting all our tables. We don't want some of our wait staff to go from taking care of a guest that haven't received their meal to bussing a table after someone has left. So we're kind of trying to promote some singularity in those job titles and make sure that we're avoiding any sort of cross-contamination. So those are some of the big things that we're getting prepared to do amongst a lot of other ones. We have several sanitization stands throughout the restaurant, just simple practices as far as when employees do enter the building, we are screening them for temperatures. We are screening them for a list of questions that are related to COVID-19 symptoms, and really just ensuring them that if they aren't able to work, that that paid sick leave isn't going anywhere, and they should be comfortable staying home if they are showing symptoms, and just going out of our way to make sure that they know we're taking it seriously, and that if they miss a day of work, that's not going to be held against them. So I think just giving them that confidence, I think, is a big deal to us as well. So for us, we're able to open at 50% after kind of moving the dining room around. It'll end up being more like 35 to 40%, just because we are maintaining that 6-foot plus distance. So despite having that 50% cap, it'll end up being a little bit less than that, just based on maintaining all the other requirements that go along with it. So getting ready to open our dining rooms on Monday, excited about it. Everyone on staff will be wearing masks. We'll be providing those. Just kind of instilling the fun and everything. We have been partnering with a local ER doctor, Dr. David Krupp. Him and his partner, they have an initiative that we were excited to jump on board with. That one is called Mask of Wellness, and he kind of started locally to try and gain some momentum. And his goal is primarily to spin this into a positive. He wants to make sure that wearing masks is seen as something that is a positive and can be fun and isn't looked at as a death stare or something that would encourage people not to join your establishment because it promotes people looking sick or looking like they might have symptoms. So he's trying to spin it into a positive to make sure that everyone kind of revels in wearing a mask for everyone else instead of the other way around. So excited to get open. Can't wait, but also want to make sure that we're doing it carefully as well.
Great, thank you, Dan, for sharing all that and what you guys are working on and planning on, and a little bit about Mask of Wellness there. I think there's so many different variables that you're trying to control for, and so thank you for sharing all that. I do want to, before we kind of open it up to general Q&A, quickly turn it over to Craig here with Phelan Tucker Law, just to chime in on just, as we saw from the poll, liability is one of the biggest concerns. So what's some advice that you have for businesses, as they plan to bring more on site?
Yeah, thanks, Kim. And I guess my initial response is, just do what my fellow panelists have said. We've got some great input and great examples of people adopting great policies and then being thorough about implementing them. I know that liability is a concern, and I would just suggest that the goal here is not to avoid being sued. The goal is that if you happen to get sued, it's not going to be successful, and that's kind of a subtle distinction. But I think it goes to there's some things you just can't prevent. Jacqueline talked about you can't prevent COVID-19 from coming into your business, but you can make sure that if it does, you have done everything you can to prevent it from being a problem. So I would say first, adopt the right policies. Look to other organizations. If you're a dentist, look at the ADA suggestions. What are they recommending in terms of keeping your dental practice safe? Restaurant industry, whatever it is, adopt the best practices. Kim, you talked about a number of things, the Iowa Department of Health. Just some great, some people have really thought out what the best practices are. And then the second step is just implement them thoroughly. Some policies are developed in some meeting and they're put in a file cabinet, they're never seen again. And but other policies, like the other panelists talked about, they're not just the policy, they are what's done day to day. And I think if you do those two things, you are going to be you're taking the right steps in terms of insulating yourself from potential liability. I heard about a business that had all its employees wear masks to make customers feel comfortable, but the masks were actually a little more than t-shirt material. And those are the types of things that make juries really angry. And so, act like you are taking care of the people that are really precious to you, your employees, your customers. Make sure it's genuine. Make sure that you are, just taking personal responsibility for their safety. And then if, something unfortunate happens, you can say, hey, we did all of these things. We implemented these things. We drilled them into our employees' heads. We had signs. And so that nobody can say, well, you didn't do what you should have done to protect people. And I think that's the best way to insulate yourself from legal liability. I would just add to that, it's always good to stay in touch with your insurance agent. Make sure that you've got the right kind of insurance protection. That's something that can change, and it's really important that you stay up with that.
Great, thank you, Craig, for sharing that. And as you mentioned at the start of your comments, all the folks on this panel are putting the right practices in place, and then some. And so my first question for all of you, as you've been developing these reopening plans, like Craig said, there's guidance from CDC, Iowa Department of Public Health, and then your industry associations. Are there any other resources besides those that you've been looking at in building those plans? Because again, some of the things you've mentioned on this call are kind of going above and beyond, those guidelines. And so curious for just, quick thoughts if there's additional resources that you're using that haven't yet been mentioned. And so I'll leave that open to whoever wants to chime in there.
Yeah, I was looking at the National Chamber's website this morning, and they have some great resources as well.
Yes, they do. We've been kind of tracking that as well, and sharing some of their things or using it to inform some of the compiling that we have on our website. So that is a good one as well. In terms of, you had talked earlier, Jacqueline, about communication, with your employees. Kind of a twofold question. One, kind of knowing your workforce, are you providing information in multiple languages to your employees? And two, how are you making sure those messages and that communication is received, and that employees are complying or are able to ask questions?
Yeah, so we're sending out email as a primary way that we are communicating, but we have shift pass down meetings for all of our organizations. And so making sure that they are able to view it via email and then have it shared in their team. And when there's room for conversation and discussion, that really helps make it come to life. We also have our team leaders and other leaders in our organization touching base with folks. If there's a very important message that's coming across, making sure that the team leader is going to those meetings and really facilitating that conversation. The COVID hotline has been a great way that people can share concerns with us as well. And we've been very open to have individuals come in and share with us also if they've got concerns. We haven't found the need really to have messaging in a different language based on our employee base, especially when you consider the fact that we're having these one-on-one conversations. We've also done a lot of education through our communication so that the people understand the why we're doing things versus just saying, you have to social distance, you have to do this, explaining the importance of social distancing and how it does stop the transmission, explaining the importance of the mask. So that people understand that it's not just something HR is telling them they have to do. It's something that they're doing to stay healthy and safe. And that's something we make sure with every message that's going out, is to say, thank you for helping keep you, your coworkers, your families safe and healthy, because that's really what we're doing, right? The work we're doing is to keep people healthy and safe. It's not just a new rule that we're rolling out. And so I think if you can make it come to life with your employees, that helps also.
Great, thank you, Jacqueline. And I want to just quickly remind folks here joining us, feel free to submit questions on the Q&A. I've got my team feeding me some questions that came in prior to the start of this webinar when folks were registering, and then some kind of backup questions here, but also want to hear from the audience. And I think we did actually have one specific addressed to Joni. Joni, is there a need to let your customers know that UV light is being used in your space, and are there any health concerns with UFC use that you know of?
I don't know that there are any health concerns. I mean, we've researched it pretty well, and it's just, and we do it in a small area. So it's not, so, I mean, it's just the wand goes over the top of the frames. So and basically what that does is it just breaks up the RNA sequence if there's any bacteria or viral that's on the frame. So I mean, I guess we haven't really necessarily said that we're using that, but I don't know. I guess I don't know the answer to that, if that's a thing that we should disclose or not. Yeah.
I think probably depending, as customers come in, if they ask you questions about it or.
Yeah. Oh, of course. Yeah. Yeah. But it's not like we don't have a big sign that says these are the things. We just tell people that everything has been disinfected and so forth. And again, I mean, things change so quickly. And so maybe that's something that we do need to let people know.
Is there anything, Joni, that you've been finding kind of particularly effective, as you communicate with your customers? I mean, I see you on social media. There are other things that are, in terms of, how you're phrasing your messages and how you're communicating, with your customers that you found particularly effective.
Well, I mean, we have signage all over the front of the store for starters. And, and then we do try to continue to message anything through our email, through all of our social media platforms. And I don't know, people seem to be pretty in tune to it, I think. So it's like, I think it's like any other marketing. It's like, it goes out there. Where does it go?
Yeah, exactly.
And if I could just add to that, one of the things that you can do in addition to some of the other things that I talked about is just make sure that you can demonstrate that you've done these things. So make sure that everything's written down. Take a picture of the sign that says, if you have these symptoms, please, leave and give us a call. They're just, you need to do them, and then to protect yourself, you need to prove that you've done them.
Yeah, and I think it speaks to things like, Dan, when you had mentioned kind of the Mask of Wellness initiative, and that businesses can self-certify if they're, following kind of the 3 guidelines they recommend. And I think what they're hoping to do with that initiative is to, increase consumer confidence and also shift the perception of mask wearing. But that, if you have that tag that, to showcase that you're a business that are following these protocols. And so I think things like that help as well. Dan, any kind of comments from your world in terms of what you're finding most effective in communicating with your customers and employees?
Yeah, absolutely. That Mask of Wellness in particular, basically it explains that business, that restaurant is what they're going for a lot is they're practicing employees wearing masks. They are also practicing that they're screening all of their employees, and they're just making a commitment to maintaining a certain level of sanitization and physical distancing efforts. So those are kind of the 3 requirements or 3 asks that we're trying to band people together with. As far as that communication effort goes, people catch on pretty quickly. Fortunately, a lot of the restaurants here in Johnson County have acted in similar ways. So people have been able to gather what is expected of them, just because everyone kind of has the same policies, and they're just doing their best to make sure everyone is safe, and that we're keeping up with the recommendations and trying to figure out what those are. Communicating with staff, we kind of have a family tree where everyone calls somebody along the line every few days. So just trying to keep everyone in touch and keep everyone positive, and let everyone know that there's light at the end of the tunnel, hopefully, here.
Yeah, you bring up a good point, Dan, in terms of just employee morale. On top of everything else, you're trying to navigate as business owners and leaders, just your own mental state and the mental state of your employees and the mental state of your customers, and just making sure to lead through this and keep everyone positive. And I think that's there's something to be said for that. That's very important, and will be extremely important as we continue to move through this reopening phase. So.
Yeah, absolutely. People have had a pretty mixed bag of emotions along the way, so it's nice to keep everyone in high spirits.
Yes, yeah. So as we're coming up on about 5 minutes left here on the webinar, and how I'd like to end this one is by asking you all to name, what is one thing you anticipate might be a challenge, over the next kind of 3 to 6 months as we move through this reopening phase. And two, what do you see as a possible opportunity or silver lining coming out of this? So I know I didn't really prep you with that question. It just came to my head. So sorry I didn't give you much chance to think about it. But does anyone want to take a stab at going first on that one?
I'll go first. So, I think in terms of a challenge, I think everybody's kind of worried about what's going to happen in the next 3 to 6 months. You don't want to go through this and then have to go through a shutdown again and that whole thing. So I think that's, I think if everybody sort of does their part, if we are as careful as we can be and try to keep everybody as safe and healthy as possible, hopefully we can avoid anything like that happening. And in terms of a silver lining, I think you get a chance to actually sort of look at your business again, at least for me, to kind of see the things that are working, things that aren't working. And it really helps you just refocus your efforts on what's important, what you're doing. So.
Great, thank you, Joni. Dan, how about you?
Yeah, as far as silver linings go, restaurant people, we're kind of band of brothers, if you will. So there's a certain sense of camaraderie that we are all in it together, and everyone does kind of have each other's back. So there is a great deal of bonding that goes behind it, just to support each other. Another small one is we've just been kind of forecasting the supplies that we're going to be using in the future, and making a huge effort to figure out whatever we're going to use, what can we change to biodegradables? How can we make sure that we're doing it in a responsible way? So just trying to kind of think upstream and figure out what we can do to do it in a responsible fashion.
Great, thank you, Dan. Jacqueline, how about you?
Yeah, I think the challenge is, we've got nearly 600 employees, and I know I've been on my own emotional roller coaster, as we all have, and to have everyone on that roller coaster experiencing things at different times has really been the challenge. And I think when we started this, we thought it was going to be a few weeks or a few months, and starting to absorb the reality that this is going to be longer than what we all originally anticipated. And so just being really aware of everyone's emotions and being able to deal with each situation that folks are in is what I see as the challenge for us in our business and what we do. And then the opportunity, and what I think has really been the silver lining on this, is it has truly shown how flexible and agile we are. We've found that we can do great things quickly, Being a part of a big corporation, we can sometimes be very bureaucratic and have to get a lot of things checked. And it's been great to see that getting the right people and right resources together, that we can move a lot quicker. And it's really had us pause and evaluate, what does business critical mean? And what are the creative ways that we can accomplish those needs? And we've strengthened our teams as we've started to have cross-functional groups work on something that they otherwise wouldn't work on. And so I really hope that that helps catapult us as a stronger organization as we go forward through this.
Great, thank you, Jacqueline. And Craig?
Yeah, I think we all have this temptation to say, oh, back in February, my business was doing so great, and if we could just go back in time and recreate that. And I think, what is important to realize is that our world has completely changed. We will never see February of 2020 again. Our customers have changed. The way we do business, the way we think about business. And so I think the challenge and the opportunity is to say, okay, my customers have completely changed. What their expectations are, what their wants are completely different. And how do I design my business around this new reality? And I think that's a question that we all are asking and need to be asking.
Great, thank you so much to all of you for answering that question there. And I just admire so much of what you've been doing to thrive through this pandemic, and then how you're thinking ahead, into the future. And I hope that everyone sees, that our business community, is prioritizing taking care of their employees, their customers, the health of the community overall. And I think that it's, I thank all of you who are on the panel today for sharing what you've shared and helping to make all of us stronger, because we're in this together, we're better together. So thank you all for being here today. And thank you to those of you who joined us today and listened in. Again, we'll be sharing this recording out with everyone, and please continue to join us every Wednesday at 2 p.m. So thank you. Stay safe.